Hey guys, so today we're going to talk a little bit about facelift. So facelift, I think, is one of the most well-known procedures that a facial plastic surgeon performs. It's often what a patient thinks that they're going to need. I'm going to go to see a facial plastic surgeon, he's going to tell me I need a facelift. Well, that's not necessarily true, and if you look at the percentage of patients that come to see a facial plastic surgeon, many of them don't need a facelift. So this is one of the most dramatic or rejuvenating procedures that we do, but many times patients they aren't quite ready for that. They don't need it. They just have a small problem that can be fixed with a little injectable or a little Botox or something like that. Facelift, the technical term for facelift is rhytidectomy. So rhytid or ridid, some people say, is a wrinkle, and ectomy means removal. So you're basically removing wrinkles. So again, we can do that very often with fillers. We can very often do that with non-surgical neuromodulators like Botox or skin resurfacing lasers and things like that. So to talk a little bit about facelift in particular, what exactly does it mean that you're doing? Well, essentially what you do is you make little incisions in front and behind the ear. So these incisions fall in the shadow line, so they should be imperceptible by the time they heal. Otherwise, it really wouldn't be worth, at least to me, making the patient look more youthful, but you're trading a scar, right? So if you're going to have a scar, it needs to be nearly imperceptible. And so you don't need to be having these type trade-offs. So once you make these incisions, you can then address any part of the face that you like. I'd say the most common places that people often need a facelift are if they have significant jowling, so the basically fat compartments of the face and skin have fallen, or you've lost volume in the midface and this is atrophied and caused this tissue to sag, or you have excess skin or fat in the submental area. We can also address the medial creases and other parts of the face with a facelift. It's very individualized for the patient. So the patient may come in, they might say, I actually like the way my face looks, I just want to address the neck. I just don't like my little turkey gobbler. I don't want you to touch my face. That's perfectly fine. Again, these incisions are just access points. Once you access the tissue, you can then address tightening in any form or fashion that you want. I'd say the majority of our facelifts, we actually also add volume to the face. So just like we do in the clinic with fillers, we'll bar a little fat. Usually the patient has a little extra on their tummy or on their thigh, and you can use that as fillers anywhere on the face that you like. So very often we'll put it in the medial creases or maybe the marionette lines, add a little bit to efface the tear trough or augment the lips or the cheeks. You can put it anywhere that you'd like, but I'd say very often we add fat to the face. It's the patient's own tissue. It's very safe, and that keeps us from having to pull nearly as tight. So if you look at facelifts 20, 30 years ago, if they wanted to get rid of the wrinkles, they just pulled the face really, really tight, and they made people look very odd. And so now we're more about slightly tightening areas of skin and excess tissue, but then adding volume to the face. And so it lets us get a significantly more natural look than we used to. And again, the patient's facelift or neck lift needs to be very individualized to what the patient dislikes about the face or neck. And you really need to have that discussion, look at the pictures together and make an informed decision. So if you have any questions about facelift, please let us know. Come in for a consultation or give us a call and we'll see if we can get them answered for you, okay? Thanks so much.